Hello, everyone. Hello and welcome to this new edition of CHAM 23. We are talking about the relevance and the quality of healthcare, and welcome to this very first roundtable, which is called Health, How and How Much We Are Wasting. Why are we starting with this topic? Well, because right now we see that the healthcare system is more and more innovative and more getting better and better results, but we have the population that gets older, and we have all the expenses related to health that are increasing, which is why we are now talking about efficiency. And it's also the question of national solidarity and sustainability of the health system. Well, we understand that right now the situation is kind of threatening, but it actually calls us to be courageous, to train each other and to try new stuff, and probably from time to time to fail as well. And it actually calls us also to be strong morally and to take additional commitments for the common good. Well, you all came at the end of September here to Chamonix. And I can tell you that it will not be very cold this afternoon. It will be approximately plus 20 degrees Celsius. But we are all gathered here at this height in order to experience some emotions. Either it will be anger, or it will be joy, or it will be surprise. So we'll start this journey from something that is very, very big to something that is very, very small, from the whole world to France. And in order to do this journey, we have 5 people with us that are participating in this debate. Stefano, SCARPETTA, who is the Director of Employment and Labor at OECD. Étienne, who is the Management Research Director at the Polytechnique School. ARMANTERAS, who is the President of the National Agency for the Performance Endorsement, ANAP, and also the President of LENNEP. And we also have 2 administrative directors, Franck von LENNEP, who is the Director of Social Security, and we have also remotely with us Mr. FATOME, who is the Director of CNAM. And so we would like to start with the world, which is why we will give the floor to Mr. SCARPETTA first of all. Well, hello everyone. This is a big pleasure for me to be here. So just to tell you, we cannot really start a conference on this topic without talking about the crisis of COVID-19, because this was a big disaster. This was a huge shock for our society as well as for our healthcare systems. The response that was brought up for this crisis was very important, because we actually saw the expenses for the healthcare that went up in a very important way. We actually reached from 8% to 9 and something percent at the level of the OECD, and we know that in France we actually came to 12.9% of expenses for healthcare. And even this very important effort for the expenses at the level of the GDP, we actually have been able to see that there were some errors that were committed and some gaps that were noticed for the management of this health crisis. So we have this very important gaps in the intermediate care and also the level of the staff, because before the crisis of the COVID and during the crisis of the COVID, we saw that there was an important crisis at the level of the staff member, but also at the level of the provisions, medical provisions. So for us, it's very important to talk about the waste and how exactly can we eliminate all the waste in healthcare, but also we have to strengthen all the advantages in the healthcare system, because we understand that we also have the debt that is being going up for all the countries of the OECD, the public debt, I would like to say, and the waste is a very important topic here. And here I'm talking about the direct cost of the treatment of the victims of the accidents, and it's 8.7% of all the expenses for the healthcare, according to the study that has been made recently. So this is just for the accidents that could have been avoided. That's why it's so important. So we have this double challenge. So on one hand, we have to bring down the waste, and on the other hand, we have to increase the resilience of the healthcare system. So for us, the increase of the investment into the healthcare system is of 1.4% of the GDP. So that's really very important for the 5-year period. And we know that in France we are at 1.5. So that's a very, very important amount. So as we estimated, we have to dedicate at least half of this to the healthcare professionals, because we have an important lack of healthcare professionals, and we also have an important problem related to their wages. We also have to dedicate some of these funds to the prevention and to the equipment. And just to give you some idea, it's very necessary to work on the prevention and the resistance to the antibiotics, but also look at the problems related to the alcohol, tobacco consumptions and diabetes, because we know that all OECD countries have right now this problem, and just €2.10 per person per parent in France have been invested for the consumption of alcohol. And if we regulate the consumption of alcohol, it actually is something that will have a very positive impact on the accident prevention in France. Now, for the tobacco, it's the same thing, because we understand that we could save more than 500 million euros per year if we regulated somehow the tobacco consumption here. We also have to talk about the tests, the protections of the staff, because I believe that the COVID crisis was an important shock for us. But at the same time, it also showed us what were the gaps in the healthcare systems that we have. So we actually understand that a lot more pressure was here and appeared here for us to manage the waste-related problems in the healthcare, especially in some of the areas, because we would like to improve the resilience of the healthcare system. We don't know whether there will be some other shocks in the future. Nevertheless, we have to pay attention to all of this, and we also have this mega trend that also implies a lot of additional expenses in the healthcare system. Thank you very much, Étienne MINVIELLE. So you actually have this international vision of the problem, but we also have a very important vision, which is from the healthcare point and people who are related to healthcare. So from your point of view, this waste in healthcare, how do you see it? And also a small additional question, is healthcare isolated or not? Because normally not. And how all the other sectors are dealing with this? So actually, I agree kind of with everything that you have already said. Well, there is a debate about the figures, but we will not really waste our time here, because 20%, well, the calculations are very complicated. It's very difficult to calculate the waste. I think it's a little bit less than 20%, but we have some medical strategies that are also considered as waste, but then later on we find out this was actually very relevant. So the calculations here are quite complicated. Nonetheless, I would like to insist on three important points. First of all, is to understand what can be saved, and we understand that that's quite a lot of work. So zero waste, I believe that this is an illusion, and I would like to take a couple of seconds here, because we cannot really talk about the fact that we can really save 20% and eliminate all this 20% of waste. Well, it first of all depends on the type of waste, but then we have a lot of negotiations and compromise and things like that, because we are in a society and with the societal challenges, so that's quite normal. And the second point is that we're moving towards the productive aspect. That's also very important, and I will go back to it. We understand that in the world, in all the complex systems like healthcare, because you have been talking about the intersectorial approach. Well, health is a topic where we have a lot of different stakeholders, different therapeutic options, different factors that are here. So it's absolutely understandable that we cannot do it like in most industries where it is very standardized. So Japanese, they were very much in advance here, and they were talking about mills in terms of waste. And for them, the most dangerous waste is the overproduction, meaning that, well, if we take an example, if we have the occupational rest rate of 90% for a surgery block, and if you make it even higher, then there will be some burnout, there will be some errors and some deficiency as well, because you will have less people. And also there is this very important debate on the time that has been lost. And this is also an organizational debate. And here I would probably go and remember Marcel Proust, who is also a philosopher and who talked about this question already, because of course we have this topic related to the waiting time, and that's another important topic here. So just to tell you that 20%, this is not something that we can save. Of course, the margin is much weaker. Nonetheless, that's still an important point. And And the second point is that, just as you have said, the different types of waste, because we can talk about the price of drugs, we can also talk about the administrative bureaucracy within the system. But I think that the very big challenge here is this organization of the care of the patient and the pathway or the journey of the patient. We can call it whatever we want, but all the systems are confronted to this fragmentation. So we are talking about the coordination, the reaction, and the uncertainty. And I would like to insist on two important points that are shocking for me here. First of all, it's very important because, well, we have already talked about the errors of orientation or double performed actions and things like that. We have a lot of them. But what is very interesting in the action, because I believe that there is one action that does not really need some negotiation, because when we are at the medical insurance or DSS, we are negotiating different costs and rates, and there is this difficulty for social acceptance. But when we are talking about this productive bet, we are basically talking about something productive, because everyone will be around one table and everyone will be discussing this same thing. And the third point that you have mentioned is that the waste is basically very much associated to the very big negative events, and we know that these negative events are also related to the problems related to the production organization. 70% are caused by the organizational things. So this is very troubling, because these are not just professional practices that are in majority, but these are also the communication-related questions, like the transfer of the prescriptions between the city and the hospital, at the admission of the patient, and so on. And I think that this is an important aspect. And I would say also that this is for this, there are many studies, and we also understand that it's 20 to 30% of time that is being used in order to get back the time that was lost. And this is the mental energy that is being lost by the health professionals. And this is also very tiring. And we cannot close our eyes at it in 2023, because right now, this is not just isolated cases, but we understand that there are many errors in terms of coordination and organization in this sense. And the very last point that I would like to insist on, well, we can be a little bit surprised on this topic, and we actually have to talk about it. This is the waste of resources, meaning that right now, at this era, we can no longer debate on this topic. Like right now, we have this round table on the waste, but we can no longer consume resources as we were doing it before. Well, I'm not really like an ecologist, a radical ecologist, but I'm very much impressed, negatively impressed, to see with all the sectors the importance and the speed of all of this. And the relevance here is a very important topic, because relevance is also the economy instead of that does not waste resources, and we have to reorient it, redirect it somehow, because for us we have to take into account this waste of resources by the consumers, and we have to think about the circular economy, meaning reuse, maintenance, things like that. These are the services that we have always attributed to the logistics, probably in a little bit fastidious way, but they are right now very important for the evolution of the system. Thank you very much. It actually allows us for Madame Armanteras to pretty much continue, because we were insisting on this question of the resources as well as the environment, and these two questions are very much related. So how do you see this topic? Well, I see that pretty much the 2 points of view up to now are very much aligned, but from your point of view, where do you see the light, if you see it? Well, first of all, I would like to say that, yes, indeed, we're aligned, and it actually also shows us this paradoxical situation of France, because Stefano is in one of these institutions that works a lot on measuring quality, relevance, and the relationships that are created to determine the quality. What is this quality? How can we measure this quality? What makes this quality? How can we measure it in the results for each country? So they actually bring a lot of methodology. So we have a lot of knowledge that comes from here. And Étienne, for years and years, has been working on different indicators. So it's a very pragmatic but also scientific approach. And we also are in this country that says that the very first source of waste is the non-quality, non-relevance. This non-relevance, of course, is not voluntary. Most of the times, it appears because we have been saying to the High Health Authority in 2018, because we thought that approximately 50% of acts and gestures that had to be motivated by the best practices were not so. So we actually have this problem of the creation of, not really of best practice creation, but of the implementation. And this is the paradox that I wanted to underline, meaning that in the world, as well as in France, we have excellent professionals, excellent scientists that, of course, have all the ad hoc agencies, and altogether they would have allowed us to move forward on quality and on relevance. But the problem of the implementation is very complicated here and very big here. So why do we have this implementation problem? Well, the first thing, I think about what Guy Valencien said in the introduction, because we have to pay no matter what is the result, what is the outcome of the health care. So we have to stop this. We have to do some works and research. What is the outcome that is a quality outcome? And we have to move forward, probably not just because we need a new financement in order to face all the new challenges. And you, Gaétan, have already asked me questions about that. But can we probably bring closer quality and non-quality to the practice, everyday practice of all the teams? So what makes it complicated to hear what you have just said with macro figures that you have just presented? And we have CNAM that also gives us a lot of examples of all the bad practices at the national level. But how do the teams position themselves in there? Because if they have their results and they can compare them, this is how they can see where they are. But if we cannot compare, we cannot improve. So the question of the results is politically important and major today, I would say. So I believe that, yes, we need a little bit of courage, but if we share this courage among us, it will be a little bit less per person, I would say. And now the second topic, well, this is pretty much the answer to the question that you have asked. We are wasting as well, far beyond of the relevance and of the quality, because we are in the system that is very reactive to the disease, but not enough proactive in terms of health care. So these are very important terms, big words, as Stefano has already said it, and the COVID has shown us that those who paid most were those who had some chronic diseases, whether they knew it or not. And there is another notion of waste that I believe is very important, is the one to say, careful, be careful, because there is not just this waste that we have been accumulating for a dozen of years or something like that, but we also have a waste that is coming, which is the waste that will be here to pay for a disease that we did not avoid, because it's very complicated to do the prevention, primary prevention, especially in some territories. So we have some diseases where we could probably delay all the effects that will consume a lot of money and time. And I'm talking here about the chronic diseases. Well, we don't really have it yet, but we probably will have it. This real dynamics on the integrated healthcare for the chronic disease in different territories. And of course, the question that appears here, and I agree with what Étienne has already said, this question of sobriety in the medical practices and in the production of care, as well as of tools used for care, drugs and different equipment. And the question of ecological care is appearing here. And it's appearing in a much more important way because, as Stefano was saying, we have to save on the waste and then reinvest it. But if we ask everyone to save this waste in order to reinvest in the system, well, we have tried to do it already, but we didn't succeed. Probably we didn't do it the right way. But finally, just to give you the figure, the NAP has organized the very first webinar on the health and ecology, and it was done without any advertisement. And the very first evening, we had 5K people attending. So it was just for the EHPADs, meaning these establishments for the older people. And we have 3K participants just for that. So to finish on this question, of course, all of these challenges, all of these issues are incredibly important. We have to save in order to face chronic diseases, people getting older, digital transition. We also have to invest and create also the environmental transition. And also we have this hope that remains here, because we actually have something that will allow us to unlock something that was what has not been available some time before, meaning digital tools. Whenever we are surgeons, we are working on a surgery, and a lot of militants are already doing it. Guy Valencien was talking about it like 20 to 30 years ago, but it's complicated for some people, because with digital tools, it's much easier to bring together all the scientific representatives and to talk about these indicators. And that's the same thing with the prevention. In order to target the risk population, to have the scanning, to actually do this prevention, and all the digital tools can help us here a lot. And I would also say that we are already wasting if we are not using these digital tools. Thank you very much. So we are doing this round table, and well, it's not really innocent, because we understand that the words are also important weapons and tools. But, well, we have this very good role because we were able to assess the situation and talk about the reality of the situation. And we also are very lucky because we have this administrative director that is working on these topics. So given everything that has just been said and that what you have noticed in your everyday life, and I know that you have talked to Mr. FATOME also because you wanted to talk about the messages that you find essential. So how do you see this topic, and how would you like to tackle these topics? Well, thank you very much. I don't think that we will be like defending ourselves or anything, because relevance is for everyone who is present in here. So first of all, I would like to congratulate for the topic that has been selected for this year, because right now, after COVID, we see that the health expenses and public expenses are a very important topic today, a very hot topic, I would say. And everyone agrees that we have to somehow support all these expenses related to the health. And this is why we have to compare everything and have the new method and the new ambitions with respect to the before COVID period. And it's important to be able to do it, not just to say that we are doing the regulations as it was before, but right now we are doing some relevance. No, we can't do it this way. It will actually require some effort, and it's also, well, just to give you a couple of examples here, it actually all requires efforts, and not just the efforts of the ADSS or CNAM, but the efforts of everyone. And just to give you probably a couple of elements for the reflection very quickly. First of all, for the evaluation, well, even without talking about the total amount of waste, for us, what is related to the action is to know and to have all the different assessments per segment of healthcare, and to have all the different targets without even aiming at 100% of targets, because as Étienne was already saying, we will not be able to get to the 100%, but just to have these targets in order to be able to somehow link the action plans to it. And the second point here is the definition. Well, here, during these 2 days, we will be talking a lot about the relevance and quality, but just behind this term waste, we have much more to that. And it actually is also the question of the price. So behind this price, do we also have the financement under productivity and some other negative factors as well? So all of this is also part of the fighting against waste. So we're talking about relevance here. So the interest of relevance and quality, because it's very important to look at both of them at the same time. So for us, for the Social Security Directorate, after COVID, for us it's very important to create this link with the patient. So not just have this regulatory or financial dimension, because yes, of course, we are here to look at the financial dimension as well, but it actually allows us to gather and to mobilize all the stakeholders as well as the patient on this dimension, the dimension that is actually quality and patient, first of all, first and foremost. And the second type of the reflection is around typology. So we have a lot of different things in the work that has been done by OECD and typology and things like that. So whenever we're talking and thinking about this typology of non-relevance, we are trying to look at what could be the action plans in this sense. So we could have some useless acts. We could also have some acts that probably could be done in a more efficient way with a less expenses and so on. And every time there is an action plan that is attached to all of this. And at the same time, we also have the difficulty that is here is to act on all the leverage points, because we also have some leverage points that are old leverage points known by everyone, and we actually have to mobilize everyone here, starting from the healthcare professionals and going all the way down to the patients. So we have here the information that must be transmitted, communication, and so on. And we also have the indicators here. The indicators of quality are very, very important, and we are quite running late here. So we have these topics related to the information that are here. The second lever is the financial lever. So we have all this financial incitation. We also have these patients and the Article 66 for the law of the patient on the reimbursement of the drugs, which is based on the generic drug types. And the second type of this leverage that we can have here is all the regulations, public measures, certifications, and things like that. So everything that is a little bit in the framework of all that. And all of these leverage points are complementary, so we cannot really activate them on each and every segment. But we still have this capacity to activate them globally, I would say, and that's still a good capacity. And all of these leverage points are quite old, and we will be talking about them throughout the whole day. So what's important for us is to be able to rely on data. We have more and more data, and I'm also very happy to see that we have a lot of round tables talking about how we can mobilize data, because we have a lot of data, and this data will allow us to do the steering of this relevance and also to get better results here. So now to finish with all the different examples of actions. So we have some measures on one hand, the measures that are related to the relevancy in the project of the Social Security law that has been presented yesterday. For example, some like measures related to the capacity of the pharmacists to appreciate antibiotics after the tests and things like that. Like there is also one of the measures that is related to the sick leave at the level of the work contracts. And there are also some measures that are here that are trying to tackle different points related to the expenditure. So the government has this priority right now and for the upcoming months that is aiming at the healthcare products. So we have had, and I believe Guy has already talked about it, we have had this mission on the healthcare products that was mentioned by the Prime Minister in the first quarter of this year, and it actually recommends a very strong collective action related to the volume, especially for the drugs. And we all know that in France we continue to have a very elevated consumption on with a lot of antibiotics and things like that. And facing this situation, we are calling for a collective mobilization and with the Minister of Health and with their lead in the upcoming months, we will be organizing together with Social Security, and we have this target for starting from the next year to do this, because we already have this project with the CNAM, and we have 300 million that are additional foreseen for the next year with all of this mission, because we are trying to get this much more balanced policy at the level of the prices. But in parallel, we also have to master the volumes and also the relevance of the medical prescription. Thank you very much, Mr. FATOME. You are with us remotely, but we have talked a lot about data. CNAM has this policy that, as we have already seen, is very in favor to the dissemination of data, and we have a lot of different tools that are here, and it actually is very impressive for me, because we have heard talking about them, and they're quite efficient. So it's very interesting to hear your opinion here, because you're a creator and also a disseminator of data. So it's interesting to see how you are tackling this topic from the point of view of the production and dissemination of data. Hello, everyone. I'm very sorry that I am not here physically with you. Nevertheless, I'm still here remotely. I will not go back to everything that has been already said, the reality of this waste and all the figures that are related to this, that are illustrating all of this. But what I would like to say is that the healthcare system, the insurance, every single year is trying to somehow find all the examples, the tangible examples of all of this, and from these examples, they're coming up with different actions. So, well, of course, the best defense is the attack. So the very first element that I wanted to share with you is that sometimes we really believe that we're really feel very lonely as the health insurance because we would like to share this efficiency, this quality measures and so on. But the advantage of all the different stakeholders, private, public, scientific, private societies and things like that, they're all publishing different elements. So we have to somehow underline all of this, somehow put it under the spotlight, because very often we're questioning ourselves and we understand, well, this year, this CHAM conference is absolutely wonderful opportunity for us to gather all the different stakeholders around these topics of quality and relevance. So as you have already said, well, we are the health insurance and we are working with the ministries and we are very much mobilized on all of these topics. Just to give you one example, and this is also one example that is very good in terms of waste and it's touching everyone. So this is the action plan that we have done, and right now we are implementing it. Why is this a good example? Because everyone is concerned, meaning the patients as well as prescribers, but also companies that unfortunately can create conditions in which we will have some suffering at work and sick leaves, and this will be waste because this will be an expenditure that is not justified. So we have to continue working on that as well and developing different tools of information, of follow-up, of control, etc., etc. And all of this has to be done with all of the stakeholders, because this topic represents a very important dynamics and we have a lot of expenditure. I also would like to go back to the point that is quite central here. A lot of people have already mentioned it. Diagnosis is here, and a lot of examples that we have also show a lot of waste here and the lack of quality. So the question that is right in front of us, and we are trying to tackle this question with our partners, and I think that it has already been said very well that first of all these stakeholders of the healthcare systems must be participating here. What is the interest of acting for the patient, for the prescriber, and for the professional, for the hospital as well, to act on the question of relevance? And I think that we actually have to promote this will and these conditions for the stakeholders to get very much interested by this question. So we are basically launching this campaign on the good use of the healthcare system. So we are talking a lot about the appointments where people did not come, like no show for the appointment and so on. Like when you don't go, you just have to tell it beforehand so that you will not waste the time. So this will be like the reflex that we're trying to install, the good behavior. Well, these are all basic gestures, but I think that the patients have to get used to do it. And this is also part of the follow-up for the patients. And we also have some other much more structural points, and Anne-Marie has already talked about it before that. We have this integrated journey. That's what we do on the heart strokes and heart problems. So it's very important to inform all the practitioners about these diseases and possibility of all of this, because if we do this proactive approach, we will have less waste, less expenses, and also organize the hospital stay for these people. If we are doing it in a proactive way, the quality is better and it's much more efficient. So how are we working with the prescribers so that their actions will be compliant with the efficiency principles? Well, of course, this will be the main topic of the negotiation that we will be launching in the upcoming weeks with the liberal practitioners and doctors. And, well, we weren't able to get these good results here because, as Franck has already said it, we have very high expectations in terms of best practices and best uses. And we also have this roadmap that is here that has been created together with the ministry for all of the stakeholders. And, of course, there is this question at the interest of acting for all of us and to offer to all of the healthcare professionals and all the liberal doctors how to act in the hospital. Because yesterday I was looking at the figures and I saw that the weight of the prescriptions in the hospital, that is also added to all the expenses related to the drugs, is went up from 32 to 33% in 2023, meaning that 1 out of 2 prescriptions is done at the hospitals. So we understand that it's in our best interest to act really quickly to master all of these prescriptions. So how, in the reforms that are upcoming for the financement of the hospitals, we can act on quality, on relevance for the community of the hospital staff and everyone that is a stakeholder here, to make sure that all of these expenses will go down. And that's an important challenge that we have shared in this roadmap. And I also would like to go back to this point that Guy Valencien has already mentioned about the obligation of means. We have two important elements that explain why it is very complicated to fight against the waste. Well, first of all, we have to reimburse as fast as possible. Can we actually get rid of this? That's an important question. And then we also have the freedom of the patient, the freedom of the practitioner. And this is another point that we are very much attached to. And just to conclude, I also probably wanted to go back to the very first question that was also mentioned by several participants of this discussion today. I am absolutely convinced that the sobriety and the decarbonation are important leverage points that are here to help us at the healthcare insurance to fight against waste. Because tomorrow we will go back to see the professionals and we will tell them that they have to do some savings. We understand that this is not easy, but when we go back to see them and we will say that it's 8% of the CO2 emissions for the healthcare systems and for the economy is 50%. So how altogether we can use all the sobriety on all of the resources of the system, just this sobriety, in order to decarbonize or reduce the CO2 emissions for all the healthcare system with the prescriptions as well. And the second point that I wanted to insist on is the data and the systems of information, because we have this digital revolution right now, and it's something that is already present. So we have to give the possibility to the healthcare professionals, the possibility to use all of this, and it basically is starting to roll on. We are giving this possibility to the practitioners as well as to the patients, and I think that in the upcoming years we will see in our systems how, at the very source, we can block a prescription, we can block also the invoicing of something, because today we have 1/3 of the patients that are going far beyond the 200 prescriptions per year. So all of this will become reality in the upcoming months. We will be able to block all of this, and I believe that this will be a very, very important point in order to fight against waste. Thank you very much. Thank you very much. I think that that's also an exercise of remote participation. I actually wanted to talk about the topic that is very transversal with respect to everything that has been said, because you have started by talking about the necessity to invest, the importance of the quality of the professionals. We have talked about the relevance, quality. So this is basically the topic of this CHAM. And we also have this very, very important topic, which is the recertification of all the healthcare professionals, because here we are talking about quality, assessment, as well as relevance. So all of these topics are transversal because we are redefining the competencies with the nurses. So at the very beginning, it was the evolution of the nurses, and it actually was a point of anger from the doctors, from the general practitioners and so on, and we are all responsible of all of this. And then right now we have also seen some nurses that were here, that were reacting at our reaction, and we actually saw this very small moving forward that allowed all the secondary healthcare professionals, all the nurses and so on, all those who were not nurses yet, to become nurses. So the question that I'm asking here in this round table, why this question of recertification, evolution of the competencies is not moving forward, because it had to be applied starting from January 2023, and right now we still don't see anything here. We don't see these references related to the competencies and things like that. So we would like to know why. So I would like to ask this round table, what do you think about this? Do you think that this is very French, or do you think that we also have some common points with other countries from OECD, and we cannot move forward on other structural topics if we cannot move forward here? So how do you see all of this? Well, it's actually fundamental for us to move forward with respect to this question, because I believe that we already were a country that was running late, and Stefano will be able to confirm all of this. We were very late with this recertification. What is the recertification? It's basically the meeting between the evaluation of the competencies and the competencies, and this is actually in the best interest of the patients. So it's really crucial for it to be out. I don't know whether the texts are blocked or what happens here, but what I regret here, because of course, if we're running late, we should regret all of this, but I believe that, well, we thought that it was very good to be recertified, meaning that finally we had to prove that we were up to date with all the knowledge and with all the competencies when we were young and not when we were old, because the recertification would not be applied to those who are quite old and quite far in their career. So it's quite difficult to explain all of this, but that's what it is. And there was a compromise here, and the deal was made like that, and that's very important. And also, I believe that in this story related to recertification, or whatever you would like to call it, the fact that we are pushing all the healthcare professionals individually to produce their results and to compare their results among them, it actually allows them to progress in terms of certification and to be much more up to date in terms of competences and knowledge. Just to you, a question to you, Stefano SCARPETTA. So probably you would say, yeah, this kind of problems, it actually is something that we have seen in some other professions. Does it move forward? Are just we blocked here? Are we isolated? Is it very French or what? Well, you are not isolated at all. This is a general problem. Just talking about quantity, in 2019, we lacked 3 million people of staff in the healthcare sector. And right now, this figure is much more important today. We also have the problem of tiredness of all the healthcare professionals after COVID, but we also have this question of recertification, meaning the competencies and leveling up of the competencies. And that's a major question, because we have a lot of problems for the entry in the educative system for becoming a practitioner, for becoming a nurse, but we also have this evaluation of the competencies and evolution of the competencies, because the job changes a lot, and some of the nurses, some of the doctors do not use all the competencies that they have acquired, or some are bi-professionals. And unfortunately, I believe that in France, and not only in France, this idea of the recertification is being seen not as a tool to have a better performance, but much more as a punishment. And this is also seen as another related to the other question, because this is also the question of resilience of all of the healthcare professionals. It's not just more doctors and more nurses, but we actually have to improve the ratio between the competencies and the access to the necessary trainings of all of these professionals. And Anne-Marie has already said that in the healthcare sector, we have a lot of data, but very little information. So we're not using the information that we have in the healthcare system. So I think that we actually have to use the information better and reconnect better all the competencies that the healthcare professionals were able to develop throughout their initial training, but also through their professional life, and to understand what are all the new demands that all the new professionals are facing, and whether they have the competencies to face all of this. Well, this is not this is an essential question for the healthcare, and I think that ChatGPT has already mentioned it for other sectors as well, because we actually don't have enough necessary competencies in order to use all of the new technologies. Thank you very much. Étienne, it's up to you. You have 1 minute. Unfortunately, we have to respect the time. Yeah, well, what I wanted to say is that it actually depends on the competencies that we're putting behind all of this, the skills, because we're in the healthcare and we understand that the skills are very important and the professional expertise is very important. But if we're looking at the analysis, what is very shocking here is that we see that the topic is basically not really here. We are talking much more about the questions of organization, communication, management, and things like that. And from this point point of view, the system is not really well educated. All the doctors, all the nurses are not really well educated here, and there is a lot of power-related questions here. So I think that that's the question. So specialized on the quality, we're always saying that is 80% of organization and 20% of practice-related questions, much more organization. So if we just talk about this, I think that there are two important points. We are very, very late in terms of management in the healthcare with respect to other service-related sectors, because we haven't worked on these topics a lot, and that's very shocking because Anne-Marie was talking about the digital. Yes, digital is very good. We have a lot of positive things. Here in Polytechnic school, we have preventions, and we are working with algorithms, and we see that new forms of preventions are being developed, and they allow us to have some much more benefic interventions. Nonetheless, it can also bring us to the worst results, meaning that the telesurveillance system that was organized in the US, they actually had three different people that came to see the patient to ask them how they were feeling. So the patient started worrying, thinking what it was about. So there is no coordination despite the surveillance system, meaning that the organization is in all of those details. And I just can tell you that we have organized this experience, and we actually showed that it's not just the digital tool that is the organization that is here. The organization is also very, very important. So, thank you very much. One of the measures that is already applied, that is already implemented, that is very important for you, can you probably name it? Well, it's actually very difficult to answer this question for me. So what I wanted to say, and I was talking about drugs just before that, so what I would like to have is this roadmap for many years that would be shared with all the different stakeholders, because in this room we have a lot of different stakeholders of the healthcare sector. So I would like to call all of you to participation, active participation, defense, not just defense in front of all others, but collaboration. We have to collaborate in order to create common goals. Thank you very much. So thank you for this message. Thank you to all the five of you for the participation. Thank you to FATOME for your participation, remote participation, and we would like to go to the next round table. Thanks a lot to all of you. Thank you.